Hello, everyone. Good morning or afternoon, depending on where you're located, and welcome to today's informative webinar titled Navigating Crisis, the Role of 988. We are delighted to have you join us as we raise awareness and promote the 988 Crisis Hotline to better equip attendees to advocate for and implement strategies that enhance crisis response and support for their communities. My name is Margot Bailowitz, and I'm a Public Health Project Assistant with the Technical Assistance and Research Center, known as TARC, at NCUIH. Joining me from the NCUIH team are Liz Beth Best, Program Manager of Technical Assistance, Molly Connors, Public Health Associate, and Amy Lord, Senior Communications Associate. We are honored to have you all here today. We kindly ask that you place your name, organization, tribal affiliation, and title into the chat box. Next slide, please. This event is made possible by the Suicide Prevention Resource Center, or SPRC, via the Substance Abuse and Mental Health Services Administration, or SAMHSA. This event is solely the responsibility of the National Council of Urban Indian Health. Findings and conclusions do not necessarily represent the views of SPRC, SAMHSA, or CDC. Next slide, please. For those of you that are unfamiliar with NCUIH, here's a little background. NCUIH is a national representative advocating for the 41 urban Indian organizations, or UIOs, contracting with the Indian Health Service, or IHS, under the Indian Healthcare Improvement Act, or IKEA. NCUIH strives to improve the health of the over 70% of the AIAN population that lives in urban areas, supported by quality healthcare centers. Next slide, please. Before we proceed, please note that this session will be recorded for educational and quality improvement purposes. The recording will also be shared to make it accessible to those who may have missed it or want to revisit the content later. Next slide, please. Please note that your mics have been muted upon entry. We always encourage participation and engagement in today's session. We invite all participants to turn on your camera and post questions and comments in the chat box. There will be an opportunity for Q&A at the end of the session. Next slide, please. As we continue our webinar, we encourage active participation and value your questions and insights. To make the most of this interactive experience, here's how you can ask a question on Zoom. Just click on the chat icon, type your question, and hit enter to send it to the group. I will now pass the floor over to Liz to go over today's learning objectives. Next slide, please.
Great, thanks very much, Margot. So we have a lot of great material to share today, and during this webinar, our aim is for you to, one, understand the function and importance of 988, two, identify effective strategies for promoting 988, and three, we've got some great resources to share, so being able to utilize available resources to support 988 awareness. Next slide, please. I know that Margot had introduced us to begin with, but here's just a little slide with more about us. And if there are any questions, you can feel free to reach out to us after this program today. Next slide, please. So before we get started, we'd like to open up with a quick poll to gauge our audience's work with 988 before we dive into the content today. So we're going to launch a poll, and I'm going to give everybody a few minutes, probably 2 or 3 minutes. There are 5 questions to work on the poll, and then we'll see where our answers ended up. And it's pretty easy. You can just toggle your mouse if you're on a computer, or use your touch screen if you're on an iPad or a phone. Looks like a lot of the answers are coming in. I'll give everyone another 30 seconds or so to complete the poll. Awesome. All right, Amy, you can end the poll. Great, and we'll go over the results. So the first question was a knowledge question. Which of the following services does 988 provide? And the answers for this one are A, B, and C. Although now that I'm thinking about it, it doesn't directly connect you with physical health emergency services, but I guess if a physical emergency was determined, a call to 911 could happen, but provides suicide prevention, emotional support, and information for referrals for mental health services. The second question is a little bit more about awareness. So how widely known is 988 within your community? The majority is somewhat known, so this is great to know that hopefully you'll be able to share out some of our resources and information today. Only one person felt that it was not known within their communities. Question 3, how important do you believe the 988 service is in your community? Very pleased to see that everybody said very important. We agree as well. Question 4, what methods do you use to promote 988 within your communities? The majority of people are using brochures and flyers, social media, with 65% of you using social media, community events, right? Having a booth or a table and promoting at a community event, 76%. Direct conversations with patients. I think that that's a great way to promote it as well when you're finishing up a visit with a patient or a client. And then some are not yet promoting it. Well, hopefully we'll be able to share some resources to promote that today. And our last question, what barriers do you face when promoting 988 to your patients? Majority is lack of awareness about 988. Cultural stigma around mental health, still very prevalent. Limited resources for promotion, and then patients' distrust of crisis services. Great, so hopefully we will be able to share some awareness about those issues today. And next slide, please. Move the poll off my screen. So we're just going to start off with some basics. So by now, most of us have heard of 988, whether we've seen it on a billboard, if you've received information in your clinic. But 988 is the 3-digit dialing code for the Suicide and Crisis Lifeline. But how confident are you feeling in discussing it with someone who is in need? It's our hope that at the end of this webinar that you will have an understanding of what 988 is, how it functions, and how it can empower us all to have crucial conversations. Launched in July of 2022, 988 serves as a direct connection to compassionate, accessible care and support for anyone experiencing mental health related distress, whether that involves thoughts of harming themselves through suicide, mental health or substance use crisis, or any other kind of emotional distress. 988 is available 24/7, offering a lifeline through text, phone, or chat. And the goal of 988 is to provide immediate assistance and connect individuals to appropriate local resources and support systems. By familiarizing ourselves with the services offered through 988, we hope to have a better support system for those around us who may be struggling and ensure they get the help that they need. Next slide, please. So a little bit about the history. I feel like most of us have probably just started hearing about 988 in the past few years, but it spans back 23 years with the history of the Lifeline beginning in 2001, when Congress appropriated funding to establish a national suicide prevention hotline, and SAMHSA awarded a grant to create a network of crisis centers to answer local calls. By 2005, the National Suicide Prevention Lifeline launched with their number 1-800-273-TALK, and it received only 46,000 calls in its first year. The following year, a Spanish language subnetwork was added, and in 2007, SAMHSA partnered with the VA to establish the Veteran Crisis Line by pressing 1 on their Lifeline number. In 2013, the Lifeline expanded its services by introducing an online chat option, and in 2015, the Disaster Distress Helpline was integrated into the network. By 2016, Google incorporated the Lifeline chat link and search results for terms related to suicide. And then the National Suicide Hotline Improvement Act of 2018 mandated a feasibility study for a 3-digit dialing code, leading to the National Suicide Hotline Designation Act of 2020, which designated 988 as the universal crisis hotline number. So a lot easier to remember than the 7-digit or 10-digit number. The change was implemented by July 2022, with text services also becoming available. In 2023, 988 launched and specialized services for LGBTQI and youth and young adults, and added Spanish language text and chat options. So over its first year, with the 3-digit number, the Lifeline answered nearly 5 million contacts, demonstrating its critical role in providing accessible mental health crisis and support. I think this slide's important because it really just shows you the journey of the Lifeline and just improvements that have been made to make it more accessible to all communities. Next slide, please. And with that, a priority of 988 is to ensure access and inclusion for all individuals during their time of need. The work of the 988 Tribal Response Cooperative Agreements Program was established to ensure access to culturally competent 988 crisis center support for American Indian and Alaska Natives. So there's a big training initiative going on now, and curriculum that is being developed for call center staff for issues pertaining specifically to an American Indian and Alaska Natives. It aims to improve integration and support between 988 crisis centers, tribal nations, and organizations. And lastly, facilitates collaborations with other providers and first responders to enhance crisis response effectiveness. Next slide, please. So a little bit about the function of 988. I know one of the questions asked was, do you feel comfortable speaking confidently about the services that 988 can provide? So as I said, the Lifeline offers 24/7 call, text, and chat access to trained crisis counselors who can help people experiencing suicidal, substance use, and/or mental health crisis, or really any other type of emotional distress. People can call, text, or chat 988 also if they're worried about a loved one. So it doesn't need to be directly used by somebody that might be feeling that distress, but if you're concerned about a friend or a relative or a family member, you can certainly call as well for support and guidance. In addition, the 988 Lifeline's website offers a plethora of material and support, and there'll be more about these resources later on. With over 200 individual crisis care centers across the country, 988 obviously, and the training involved is no small undertaking. These crisis centers act as a local resource for individuals going through mental health crises. In addition, fielding calls, crisis centers provide training and educational resources on suicide prevention, mental wellness, and resources for mental health professionals seeking advice and best practices. There is no application or membership fee for crisis centers, but there are requirements. These requirements do include data collection, Lifeline periodic testing, evaluations, security, operational services, and training. On this side, you will see all the required courses for 988 call centers as of 2024. In addition to these courses, call centers can offer additional courses that are tailored to populations higher at risk of suicide and overdose. Next slide, please. So the importance and need of 988 in Indian country is an understatement. American Indian and Alaska Natives continue to have high rates of suicidal ideation and attempts compared to other racial or ethnic groups in the United States. And this statistic holds true for those youngest in Indian country as well. Indigenous high school youth were more likely than any other racial or ethnic group to seriously consider attempting suicide or make a suicide plan. Between 2011 and 2020, death by suicide increased from 17 to 100,000 people to 24 per 100,000 people, roughly 10% higher than the overall death by suicide rate in the United States. Next slide, please. So a little bit about understanding the reason behind the call. And I created this slide. I was talking to somebody about 988 before we worked on these slides. And they thought it was just for somebody that was in severe crisis, right? Like when you'd wait to call 911 and thinking, is it really an emergency or can I wait for urgent care the next day? But a call to 988 does not need to be just for somebody that has experienced an extreme mental health crisis. And the call can happen for a number of reasons, including suicidal thoughts or feelings, emotional distress, substance use crisis, any type of mental health issues, domestic or interpersonal issues, crisis de-escalation, or access to resources and referrals. And we all know the long wait times for behavioral health sessions. And so promoting 988 is a great way within your communities to kind of bridge that gap until somebody might be able to, get an appointment for behavioral health care. Next slide, please. So how does it work? And I spent some time calling and learning more about it myself because it took me a little bit of time to, really understand what happens when you call 988. So when you call 988, the process is designed to connect you efficiently to the support you need. And 988 has really done a great job getting wait times down for people on the other end. You have the option to self-identify, such as pressing a specific number if you need veteran crisis services. If you don't self-identify, the call is routed to the nearest crisis center based on your area code. So this still might make it a little bit tricky if you're calling from a cell phone. I live in New Hampshire, but my cell phone is in New Jersey, so I would therefore be connected to those resources, I believe, at this time. Once your call is directed, trained crisis counselors are ready to assist in de-escalating mental health crisis with emergency services dispatched only in less than 3% of cases. And I know that is one of the concerns why people might be hesitant to call, not wanting to, activate police or ambulance to come if they really just need somebody to talk to or some resources. Anonymity is respected, so you do not need to give out identifying information, and it only requires minimal personal information like a phone number or an IP address, and geolocation is only used when necessary for safety. Efforts are underway to develop cultural competency training tailored to American Indian and Alaska Native populations, ensuring culturally sensitive support. And additionally, a dedicated resource database is being developed to offer services and resources specific to Indian country, enhancing the accessibility and effectiveness of crisis response through 988. So some of you might have received outreach. I know we had shared a survey in a database where UIOs could share resources within their areas that have to do with behavioral health. And then they will be lifted into a database which will be eventually live on the website, but also be shared with the call center operators. Next slide, please. So understanding community needs is important to effectively promoting and implementing services like 988. So being aware of what resources are available within your communities, but how are people feeling within your communities about 988? So here in NCUIH, in April of this year, a UIO requested technical assistance from NCUIH to help interpret and compile data collected from a needs assessment that they had created to gauge their community's knowledge of crisis mental health preparedness and services and 988. So with their permission, we are sharing the word cloud and demographic assessment analysis. And this is just one urban community where you can see how community members, their knowledge, their perceptions, and their attitudes with regard to 988. So for this specific needs assessment, a total of 36 individuals filled out an anonymous questionnaire distributed over 4 different community events. Less than 44% of the respondents stated that they were aware of the 988 crisis line. So that's basically like only 1 in 2 people knew to call 988 to help themselves or a friend or a family member. Of those who stated that they were aware of the crisis lifeline, 57 identified as females, and they were between the ages of 21 to 59. Elders, youth, and those who identified their gender as male were less likely to be aware of 988. A word cloud was made for this open-ended survey, questions asked, and you can see it here. But regardless of whether a respondent was aware of 988, they expressed a need for mental health care providers and first responders. Respondents stated that professionals should respond rapidly with care and cultural competency. And they also expressed the need for resources and concerns over the safety of others and the individual experiencing a mental health crisis. So now we're going to move into what can be done to promote 988 and how you can use the resources that we're going to share to promote. And for that, I'm going to pass it on back over to my colleague, Margot, who's going to identify some strategies for you all.
Thank you, Liz. So yeah, again, now to address our second learning objective of identifying effective strategies for promoting 988, I want to share some preliminary results from a baseline website and social media scan that I recently conducted in order to identify promotional trends among UIOs. So the scan's goal was to provide SPRC with current insights and areas for improvement in terms of these 988 promotions from UIOs. So the scan took place between March and June of 2024. All 41 UIOs were included in both website and social media scans. For the website scan, on each website, a search function was used to search for the terms suicide, suicide prevention, 988, and 988 hotline. And when looking at the websites, we were scanning for any mention at all in general of suicide and or 988. We were looking to see if there was inclusion of the 988 hotline within a larger hotline list or contact information section. Was 988 mentioned on a UIO's website homepage, or was it maybe listed on a behavioral health services page? And we were also making sure to look out to see if there were any promotions of out-of-date hotline information. For the social media scan, main page Facebook, Instagram, YouTube, and LinkedIn posts that were made between May of 2022 and June of 2024 were scanned for each UIO. So this timeline was chosen to account for any promotions that were made leading up to the launch of the 988 rebranding on July 16th of 2022 until the present. And for this portion of the scan, data were collected to determine whether or not each UIO posted about 988 at least once on at least one platform, and which platforms were used most heavily, how many unique non-duplicate posts were made from each UIO. Did UIOs post about 988 during September Suicide Prevention Month or May Mental Health Awareness Month? Did UIOs post about 988 around the time frame of that July 2022 rebrand? And were UIOs posting their own materials about 988, or were they more commonly reposting materials made by external organizations? So those were just some of the things we were looking out for. And I want to note that evaluating really the true impact or effect or reach of these 988 promotions was beyond the scope of the scan, but instead the following results will hopefully identify some common promotional trends and gaps that can inform future promotions at your organization. And additionally, this will be sort of a high-level overview of all of the data that were collected in the scan. Next slide, please. So, diving into an overview of the results, we'll start with the website scan. So out of all 41 UIOs, 31 websites mentioned suicide and/or suicide prevention services or awareness in some capacity. 22 UIO websites had specific mention of the 988 Lifeline itself. The most common website location where 988 was listed was on a behavioral health or related services page from a total of 14 UIOs. Next, 11 UIOs promoted 988 on their websites through inclusion on like a larger list of other hotlines. And on the next slide, we'll dive into some of the themes that emerged from this portion of the scan. Next slide, please. So the 4 trends that I'll share on this slide can hopefully help to inform how your organization uses your website to promote the 988 Lifeline. So firstly, 4 UIOs are currently creating awareness about 988 through the Google search feature simply. So for those 4 organizations, just typing the UIO name itself into the Google search bar actually generates information about 988 and about SAMHSA as the very first result, even before the result with the actual UIO website and information. So this type of search result, an example of that visually can be seen in the image on the left of this slide. And I think this theme really gives an example of how you can use promotions that make sure to really maximize your audience and your potential reach. The second common theme that I encountered from the website scan was the promotion of 988 through larger lists of hotlines. So as shown in the results slide, 11 UIOs use this form of publicizing 988. So whether listing other national or regional and local hotlines, I think this is an effective and straightforward strategy for providing multiple resources in a centralized location on your website. And the top middle image on this slide here shows an example of this type of list that was seen in the scan, which can of course be customized to the needs of your local community. And then another important point of note is to make sure that when choosing to provide these hotline or resource lists that they stay up to date as information changes. So we found that a number of UIOs were actually promoting an out-of-date version of the National Suicide Hotline instead of the rebranded 988 code. And you can see an example of this in the bottom center image in the slide. So just something to keep in mind for your promotions. And the last website strategy that I want to touch on is the inclusion of 988 within your website's contact information section. So I'm sure many of us are familiar with sort of scrolling down to the bottom of a website to quickly look for key information, like an organization's hours or their phone number. This bottom banner of a website will often list the organization's address, maybe their social media handles and contact information. And so from the website scan, I found one UIO that actually puts the 988 number within their listed contact information for their organization on this bottom banner of their website. You can see a screenshot of this example in the rightmost image on this slide. So I think that this really has the potential to be a very effective strategy for promoting 988 because, you know, the contact information section tends to get a lot of traffic from viewers, and that bottom banner appears on all web pages across the website. So whether you choose to promote 988 on your own sort of contacts web page within your website or in that bottom banner, I would definitely encourage considering adding 988 to your organization's contact information on your website. Next slide, please. So moving on to the social media scan, 33 out of all 41 UIOs posted about 988 at least once on at least one of the 4 scanned platforms during the designated time frame. And the mean number of total unique, meaning non-duplicate, posts about 988 from one UIO across all platforms was 5.73 posts. And the most common platform for 988 posts was Facebook by 33 UIOs, followed by 25 UIOs posting about 988 on Instagram, 7 on LinkedIn, and 1 on YouTube. And the chart on the slide here shows how the number of UIOs, shows the number of UIOs that have respective social media accounts compared to the number of UIOs who use those platforms to post about 988. And so now that we've given a bit of an overview of those results, we'll jump into some themes identified from the social media scan. So next slide, please. So firstly, a major trend when posting about 988 on social media was to combine promotion with other types of subject matter. So out of all 41 UIOs, about 70% of UIOs made this type of post that has graphics of 988, it mentions 988, but also in conjunction with other information or themes. And then of the 33 UIOs who made any post about 988, about 88% of them made this type of combined promotional post. So other subject matter in these posts ranged from, general educational material about mental health to promotion of organization-specific events and services, trainings, and more. The leftmost image on the slide here shows an example of this type of social media post where you can see that 988 graphics are included and it's being promoted, but sort of the larger overall theme of the post is education about how to support someone that you know in a crisis. So posts like this, of course, adapted to your organization and your community, can be a great way to use, your regularly scheduled relevant content to also expand awareness of the 988 Lifeline. The next identified theme that can be an effective strategy for promoting 988 is to post about 988 in honor of awareness days and events. So for example, the second image on the slide is a UIO post that includes 988 graphics and imagery and information in honor of September Suicide Prevention Month. And other awareness days and events that were mentioned in UIO social media posts include World Suicide Prevention Day, World Semicolon Day, Depression Awareness Day, and many others. And so these events and more really provide ample opportunity to promote 988 to your communities. And another common theme was the reposting and or use of materials created by external organizations. So there are many amazing graphics and posts being made by other UIOs and national organizations that can be shared with your communities as well to further spread that awareness. So for example, the third image on the slide shows a post made by We Are Native that was reposted by a UIO on Facebook. And some other common organizations that were reposted by UIOs in the scan include, the 988 Suicide and Crisis Lifeline itself, SAMHSA, the American Foundation for Suicide Prevention, for example. And similarly, the last trend I'll share was the common use of SAMHSA branded 988 graphics by UIOs. SAMHSA has really amazing and an extensive social media toolkit with downloadable materials that can be shared among your communities. And I think later we'll touch on where to find those graphics. Next slide, please. So in summary, the following recommendations can be made based on the trends and gaps that were identified by the UIO 988 website and social media scans. So firstly, just make sure to be mindful of any out-of-date hotline promotions and to include, the rebranded 988 code in those promotions. Another recommendation is to include 988 in any other posts you're already making about suicide prevention and mental health education in general. Next is to post about 988 for relevant awareness days. So in the next few months will be September Suicide Prevention Month and American Indian and Alaska Native Hope for Life Day in September. So those are some great opportunities coming up to promote 988 to your communities. Next is to expand promotions across all social media platforms. So we saw from the scan that Facebook was definitely the most popular platform for posting about 988. So definitely continuing to do so, but also thinking about how promotion can be expanded across other platforms. And then lastly, to continue sharing those SAMHSA graphics and 988 posts made by other organizations to spread awareness in your communities as well. And I will go ahead and pass the floor back over to Liz.
Great. Thanks for sharing all that, Margot. So I'm going to share where you might be able to find some of the resources to support 988 awareness. And just to let everybody know, sometime early next week, we will share around this recording, the slide deck, and we also have a one-page key takeaway document, which will have links to many of these resources shared. And just adding a few things onto what Margot said, she shared some really great ways that you can promote via your social media, but you might also consider reaching out to, for some of these resources, such as posters that you might be able to include in your clinic. If you have a recording on your phone line after hours, perhaps making mention of 988 there if it is, a mental health crisis or emergency. So getting to know resources over these next few slides, we'll focus on national resources that support 988 awareness, but they can all take you to more localized resources as well. It's important to stay connected within your community because these organizations and people can be the first ones to help should a crisis occur. The image shown, for example, on this side of the slide is a flyer of a local and national resources that were just found in a Tampa Bay coffee shop in early 2020. So there are lots of organizations ready to help. So get to know them and at least their contact information to share. Next slide, please. So if you scan the QR code here, it will take you to the 988 Suicide Crisis Lifeline webpage. And this is really great because you can click through and look at some really great resources to pass out in your community. Another option, as we shared, would be to one-on-one talk with your patient population. You can share stickers or magnets. There's wallet cards, so you can have those available at the front desk of your office as well. And these are all free. You can make bulk orders by reaching out to the website here. We ordered a bunch for our national conference. They came really quickly and they were awesome. They just flew off of our table, people really wanting these just different items that promoted 988. Next slide, please. So here is a link to the Substance Abuse and Mental Health Administration, which is the lead federal administration for all things 988. There's a great radio ad here. So any communities that want to use a radio ad, this is a great one that explains what happens to 988. And there's also links to some other resources, including a 988 partner toolkit on this slide. And next slide, please. We also wanted to share out and mention mental health first aid. Put an emoji in the box if you've taken mental health first aid training. If you haven't, it's a really great thing to take. As someone who's worked in behavioral health for a while, I took it, I believe last year, NCUIH offered it here, and I really learned so much. And in the year that I've taken it, I've used many of the strategies. So you can visit the Mental Health First Aid website, link here. Again, this is a national program to teach the skills to respond to the signs of mental illness and substance use. So many of us have taken like regular first aid. This is first aid for mental health issues. And it's a really great training if you haven't had the opportunity to take it. I think Molly's going to drop a link to it in there. And next slide, please. And the last national resource organization that we're going to highlight today is the Suicide Prevention Resource Center. As we stated before, this webinar is made possible through our partnership with them and the work that they're doing. The Suicide Prevention Research Center, it's the only federally supported resource center devoted to advancing the implementation of the national strategy for suicide prevention. The links on this page, and we'll drop them in the chat as well, will take you to their main library. They've a lot of different trainings that you can do as well as resources. And not only do they allow access to SPRC's own resources, but you can find other organizations' resources and filter out to what you're looking for. So I think these 3 pages, you should be able to find what you need in terms of resources that you're looking for in terms of crisis prevention. So we encourage you to look into all these resources. And again, we're going to be sharing a takeaways document that will be emailed next week. And with that, we'll go on to our next slide. And we're going to just have a little sharing session. I'd love to hear what folks are doing in their own communities with regard to promoting 988, or any questions or comments that you might have. You can pop it in the chat or feel free to come off of mute. I know that Jerry Rainingbird had put a comment in earlier, and I didn't address it during the talk, but they talked about, he had mentioned in Washington, when you call their lifeline, you are directed to the Native Lifeline, which is for American Indian, Alaska Native populations. I believe it's the only one in the country. I don't know, Jerry, if you want to come off and share a little bit about it, but from what I've heard, it's a really, really amazing. And, you know, just how many calls are you guys taking? And I know that you have a lot of, you know, follow-up calls that you're doing now to, you know, check in with folks after they've called in.
Yeah, thank you. Just a moment to say, yes, we are really excited and very inspired and motivated by the fact that Washington does have an emphasis on ensuring that our American Indian Alaska Natives, both urban and rural, are accessing 988 and are being responded to in a culturally competent, culturally informed way by Native folks who have been trained and are on the line 24/7. And it's just been an amazing experience to partner with those folks, because they are actually administered by the Volunteers of Western America, Volunteers of America, Western Washington. And I work with the Washington Department of Health Suicide Prevention Program, and we manage the Native and Strong suicide prevention media campaign for our tribes and Native communities in the state of Washington. And so we partner with the Native and Strong Lifeline to provide all of our Native folks, when they call, with access to links, resources, people to speak to, how to get more engaged, advisors, wisdom keepers within their home communities or within that part of the state. And we work closely with Thrive. You mentioned We Are Native. They are part of the Northwest Portland Area Indian Health Board. We partner with them as well. The Area Indian Health Service. I put in a chat that Joe Law and Kirsty Woodward from the Portland Area Indian Health Service provide mental health first aid for Indigenous communities trainings. And so I just really feel grateful that we have that collaboration in place, and just encourage anyone and everyone on the line to reach out and visit those websites, contact those folks, and learn more, and how you can access either training or information on how to implement a more community-driven effort in your respective part of the country.
Great, thank you so much for sharing that. I didn't mean to put you on the spot, but I really wanted you to share a little bit about that, about your work that you're doing. So great work, and thank you. Any other questions or thoughts or comments? Yeah, here's a good question. Has anyone heard of using AI in heard of or using AI, I guess, in terms of creating content for 988 awareness or for, I guess, social media postings? Right.
Hi. Yeah, so I have Dominique from Denver Indian Health and Family Services. One thing that I found, I don't know how many of y'all use Canva for some of your content creation, but Canva has some built-in plugins that you can utilize AI in. And some of them are really great because you could say like design a landscape with a buffalo and a pond with the 988 messaging, and it'll pull in like the 988 actually branded materials and lay those into your messaging. And it takes maybe a minute or two to create that. So that's just been a really helpful resource, and it's all like built right there into the platform.
Great, thanks. I haven't used Canva that way, but I've heard of those capabilities. So thanks for sharing that. I think another question came in. So Letitia asks, do you have any information on the response of different UIOs are having to these types of posts? So Margot, I don't know, in your research, was there a lot of engagement, either likes or sharing? I think one thing, that we hope with our social media, especially when building an awareness campaign, is that we want to have shares, right? And so I'm curious if you found that out during your research, Margot.
Yeah, well, thank you for the question. Unfortunately, I don't have a lot of like true data on the response to a lot of these posts. Unfortunately, it was just sort of beyond the scope of the scan by looking at 41 total organizations. So I wasn't tracking like the amount of likes or anything like that. But certainly resharing posts from other organizations, sort of as I mentioned before, was a huge trend. Both among UIOs, but also among NCUIH. I think NCUIH makes a great effort to repost posts made by UIOs. So that was definitely something I noticed. I wish I had like more concrete data about it, but I think it would be really cool in the future to like either select one UIO or organization, or maybe do a sample of a few UIOs and work more closely together to be able to see like the true effect of the posts on social media and look at some of those analytics.
Great. And I know here at NCUIH, we are planning a Hope for Life social media campaign. So that will be September 10th. And we invite all of you to share our posts. So, but yeah, sometimes there really is no need to reinvent the wheel, especially on awareness days or awareness month. And sharing is a great idea if you're, don't have the creativity on your staff or you're crunched for time, is to just be aware of how you can share things out. Any other questions? Great. If there's no more questions, we'll go on to the next slide and I'll pass it back over to Margot.
Thank you, Liz. And thank you everyone for your questions and participation today. We greatly appreciate your time and effort to help us shape future events. So please scan the QR code or click the link that will be placed in the chat to be taken to our brief survey for today's event. Next slide, please. NCUIH is committed to supporting our UIOs and the important work and services they provide every day for individualized technical assistance in everything ranging from agency regulations to UIO billing and coding. Please fill out and submit our technical assistance form link found on our website and provided here in the chat box as well. Next slide, please. So please register and join us for upcoming NCUIH events. with the link that will be provided in the chat box as well. So our next event is on Tuesday, July 16th. It is prevention and control practices addressing wound care. Following that, on July 23rd, will be clinic to community, utilizing the 340B program to improve HIV care for urban Indian populations. On August 7th, we have our second IHS HIV office hour session. And then on August 22nd, we have investing in wellness, financing strategies for behavioral health in Indian country. Again, the links for all of these can be found on our NCUIH website and in the chat box. And we'll also be placing a link to NCUIH's AMA Education Hub, where CEU accredited media can be found at any time. Next slide, please. So thank you all again so much for joining us today, and we look forward to seeing you all at our next event. Have a great day.